Have you ever heard of Fibrodysplasia Ossificans Progressiva, or know of anyone living with this disease? Join me today as we explore a rare genetic disorder characterized by the gradual transformation of soft tissues, such as muscles, tendons, and ligaments, into bone. This is Fibrodysplasia Ossificans Progressiva, also called Stone Man disease. We will look at what it is, causes, signs and symptoms, complications and treatments. Imagine a world where your muscles, tendons, ligaments could turn to bone slowly, silently, and without warning. For most people, the idea sounds like something from a science fiction movie. But for a handful of individuals around the globe, this is their everyday reality. Today, we're unraveling the story of one of the rarest and most baffling conditions known to medicine, Fibrodysplasia Ossificans Progressiva, or FOP. Join us as we explore how this mysterious disorder transforms the body and what science is doing to fight back. What causes Fibrodysplasia Ossificans Progressiva? This is caused by a mutation in the ACVR1 gene, also called ALK2. This gene normally helps regulate the growth and repair of bones and muscles. In FOP, the mutation causes the body to mistakenly turn soft tissue, like muscles, ligaments, tendons, and connective tissue, into bone. The extra bone forms in flare-ups, often triggered by minor injuries like falls, bumps, or cuts, muscle strain, viral infections like the flu, or even injections and surgeries. Imagine waking up one day and realizing your muscles are slowly turning into bone. Your body is literally trapping you inside a second skeleton. This isn't science fiction. This is a real condition, and it's called Fibrodysplasia Ossificans Progressiva, or FOP. FOP is one of the rarest and most horrifying diseases on Earth. Fewer than 1 in 2 million people suffer from it. Instead of healing normally, the body forms extra bone in places it shouldn't: muscles, ligaments, even tendons. Over time, patients become frozen in a rigid shell, like a living statue. So what actually causes FOP? The answer lies deep within our DNA. FOP is triggered by a single tiny mutation in a gene called ACVR1. This gene acts like a master switch for bone growth. In people with FOP, the switch is stuck in the on position, sending constant signals to the body to create bone even where it doesn't belong. This mutation is not inherited from parents in almost all cases. It happens by chance, during the earliest moments of life. Scientists are still unraveling exactly how this one genetic typo leads to such devastating consequences. The first sign often appears at birth. Children with FOP are born with malformed big toes. But the true nightmare begins in childhood, when small injuries or even injections trigger the body to grow new bone. Imagine falling off a bike, and instead of healing, your muscles solidify into bone. Once the process starts, it never stops. The disease moves in a terrifying pattern: neck, shoulders, back, arms, then legs. Slowly, joint by joint, the body locks up. Patients lose the ability to move, to bend, even to breathe properly, because the rib cage turns rigid like stone. Most people with FOP end up in a wheelchair by their 20s. By middle age, many are completely immobilized, their mind sharp, but their body frozen. The average life expectancy is around 40 years, often cut short by complications like pneumonia. There's no cure for FOP. Even surgery makes it worse, because cutting the bone just triggers more bone growth. But researchers are racing for answers. In 2006, scientists discovered the exact gene mutation that causes it. Today, new drugs are being tested that may finally stop the body from turning itself into stone. Treatment and management. There is no cure yet, but research is ongoing. Avoidance is critical. No intramuscular injections or surgeries, as these trigger new bone growth. Avoid trauma from sports or accidents. Medications. Corticosteroids like prednisone may reduce inflammation during flare-ups. Pain relievers and anti-inflammatory drugs can provide comfort. New experimental drugs target the ACVR1 mutation to try to stop abnormal bone formation, but these are still in trials. Supportive care includes gentle physical therapy to avoid trauma, breathing support when the chest becomes rigid, and nutrition support if the jaw is locked. Research hope. Clinical trials are testing drugs that may one day halt or slow the disease. Fibrodysplasia Ossificans Progressiva is proof of just how fragile and strange the human body can be. It's a reminder that sometimes the scariest prison in the world is your own body. If this story shocked you, imagine living it every single day. Help spread awareness of this devastating condition. Share this video, hit subscribe, and join me as we uncover more of the world's most mind-blowing medical mysteries. Click the video on the screen to learn about Stone Baby, the rarest pregnancy worldwide.